Excellencies, heads of state and government, honorable ministers, Director General of Africa CDC, distinguished partners, ladies and gentlemen, I would first like to thank Africa CDC for the rapid convening of this important ministerial meeting dedicated to Ebola, which is currently affecting the Democratic Republic of Congo and Uganda, with a high risk of regional spread. I also wish to commend the remarkable leadership of the Director General of Africa CDC, as well as the commitment of the governments of the Democratic Republic of Congo, Uganda and South Sudan, who demonstrated during the Kampala meeting that Africa is capable of speaking with one voice on health threats by finalizing a $319 million response plan. This epidemic reminds us of a fundamental truth. Health security is now a matter of sovereignty, economic stability, peace and continental security. Africa can no longer remain vulnerable to repetitive health crises. It is unacceptable that 19 years after the identification of the Ebola Bundibugyo virus, the world still has neither an approved vaccine nor a specific treatment against this strain because this disease has not affected the Western world. This reality must challenge us collectively. Our populations must no longer depend exclusively on the funding priorities, supply chains, and production capacities of other regions of the world to protect their health and lives. That is why this crisis must accelerate our agenda for African health sovereignty. Excellencies, ladies and gentlemen, the African Union fully supports Africa CDC's declaration of this epidemic as a public health emergency of continental security, as well as its continental leadership role in coordinating the African response. We also welcome the coordination approach implemented around the principle of one team, one plan, one budget, and one monitoring framework. Africa must act in a coordinated, united, and strategic manner. I would like to commend the African solidarity that is already beginning to materialize. I warmly congratulate His Excellency President Cyril Ramaphosa and the South African government for their voluntary contribution of $2.5 million to Africa CDC in order to support this continental response. This gesture is important. It concretely reflects the principle that African problems require African leadership and African responsibility. I also welcome the mobilization of the African private sector, particularly that of Mr. Aliko Dangote, Professor Benedict Orama, and other economic leaders of the continent who stand alongside Africa in these difficult times. This epidemic must also serve as a wake-up call to strengthen our investments in pandemic preparedness. We must accelerate the development of national public health institutes, the Emergency Operations Center, the surveillance system, genomics, community health workers, and above all, African capacities in research, innovation, and local manufacturing. Excellencies, ladies and gentlemen, the African Union will remain fully mobilized alongside Africa CDC, member states and all committed partners to put an end to this epidemic and build a more resilient, stronger and more sovereign Africa. Thank you.
Excellences, Mesdames et Messieurs, l'Union africaine restera pleinement mobilisée aux côtés d'Africa CDC, des États membres et de tous les partenaires engagés pour mettre fin à cette épidémie et construire une Afrique plus résiliente, plus forte et plus souveraine. Je vous remercie.
If you like this video, then like, share and subscribe to Mirror Now.